Mercury is a transition metal found in group 2 of the periodic table. Mercury has long been known as quicksilver. Its symbol, known as Hg, comes from the Latin term hydrogrurum, means watery silver. It presents in various states such as solid, liquid, or gas. The history of mercury. The oldest sample of mercury dates to about the 50th or 60th century BC, found in Corona Egyptian tomb stored in small glass container. Many reports said that slaves worked in Roman mercury mines often died after the exposure to mercury. Mercury amalgam has been used for a long time. An amalgam is a combination of mercury with at least one other metal such as silver, used in the restoration in dentistry. The mechanism of action. The toxicity of mercury mechanism based on irreversible inhibition of selenoenzymes, which lead to produce reactive oxygen enzymes, results in brain cell dysfunction and eventually lead to death. The uses of mercury in today's society. The important use of mercury is in the preparation of chlorine to pass the electric current in the industrial setting. Also, it can be used in dentistry amalgam and in the production of fluorescence lamps. The extensive use of chlorine-based chemicals and other industrial activities resulted in the increase of the quantity of mercury released to the atmosphere. Once it settles on land, it is transported by rainwater into lakes and waterways, and eventually it's led to the ocean. When it leaches or is dumped in waterways, high concentrations of mercury can accumulate in fish. When mercury settles into the sediment of lake or stream, it is ingested by bacteria and other microscopic plants and animals at the base of the food chain. The microscopic organisms are eaten by large creatures such as fish, frogs, which retain the mercury in their body fat tissues. A person consumes 6 ounces of mercury when ingesting fish such as swordfish, Chilean, sea bass, tuna, and Alaskan halibut. Since 1950, mercury has been recognized as being toxic for humans in doses of 35 microgram per deciliter. The number and severity of symptoms depend on many factors and are classified into either chronic or acute symptoms. First, we're going to talk about acute symptoms. In case of mercury ingestion, local corrosive effects such as nausea, vomiting, severe abdominal pain, metallic taste, and renal damage could occur. On the other hand, chronic symptoms include asthma, Alzheimer's disease, autism, cardiovascular disease, kidney disease, liver disease, and damage of the CNS, and also infertility could occur. The treatment of mercury poisoning. Identification and removal of the source of mercury is crucial in treatment. Also, decontamination of clothes is also needed. Then wash the skin with soap and water. Patient should also be given chelation therapy either orally by DMSA and D-penicillamine or intramuscularly by BAL. Prevention and regulations. Firstly, the FDA recommended that pregnant women should stop eating any source of fish from the ocean, such as shark and swordfish, because of high levels of mercury. Secondly, to increase the intake of omega 3 and antioxidants. Thirdly, prevent the excessive intake from the tuna fishes. Fourthly, prevent the excessive use of mercury in the industrial area. And finally, to regulate the use of amalgam in the dentistry filling.